students, welcome to the Outpatient and Physician Office Coding, where we're going to go through some of these outpatient guidelines. So in outpatient care, primary care services include preventive and acute care that is provided by physicians as that first point of contact into the healthcare system. So primary care providers, otherwise known as PCPs, take responsibility for managing and coordinating a patient's care, and they really develop and sustain that partnership and relationship with their patients. The PCP can refer patients to other medical specialties as needed for like second opinions and or consultations. So an example would be a patient presents to their primary care physician for an injury to their wrist, and after an x-ray and exam, it is determined that the patient sustained a distal radius fracture. Therefore, that PCP is referring that patient to an orthopedic physician. So outpatient and ambulatory services are billed on a CMS 1500 claim form to generate reimbursement for these outpatient services. With the exception of home health and hospice, they actually are billed out on a UB04 claim form, which is for the hospital, and that's per CMS guidelines. So ambulatory patients in the hospital outpatient service settings, they're usually treated and released the same day, so no overnight stay. And then ambulatory surgery patients, procedures that are performed on an outpatient basis, and that patient is usually released the same day as well. You'll also hear the terms for these kind of patients as same-day surgeries, and these can be performed in an outpatient hospital setting and or like a free ambulatory surgery setting. Emergency care patients, these are going to be your ED or your emergency room visits, and patients are usually released the same day. Sometimes, of course, there may be an overnight stay. Say if that patient presented to the ED, say at 8 o'clock at night, and then they're not discharged until the next morning, say maybe like at 4 o'clock in the morning. That's when you might have an overnight stay. Observation patients. For an observation patient, there needs to be an admit or an admission order that is required by the admitting physician that shows the patient is being placed in an ob status. The length of stay is usually 23 hours or less than 23 hours, but it can be up to 2 days, and I've even seen an OBS patient in an ob status longer than 2 days. It really depends on the patient's circumstance, as sometimes they may never meet inpatient criteria, so they stay in that ob status. First listed condition. In an outpatient setting, the first listed diagnosis or condition is used in lieu of that principal diagnosis term, and it is the condition or problem that is documented by the physician to be chiefly responsible for that encounter or visit. And just a quick note, the terms encounter and visit, you're going to hear them used interchangeably when describing outpatient services. So an example would be, say a patient presents to the physician's office with a fever and a cough, and after chest x-ray and the physical exam, it's determined the patient is diagnosed with pneumonia. Now the patient also has a chronic condition, asthma, and the patient did refill the physician did refill the patient's prescription for albuterol. Now you can see their first listed diagnosis, because they were diagnosed with pneumonia, would be 486, and I also have the ICD-10 code there just so for reference. And then we're also going to code the secondary diagnosis of asthma because it is being managed, and they wrote that prescription. Fever and cough would not be coded because they're symptoms codes, and they're considered integral to the pneumonia. Now for outpatient surgery, the first listed diagnosis is the reason for the surgery. And if that surgery, say, was canceled due to complication or blood work that came back, the first listed diagnosis would still be for the surgery, followed by the reason it's being canceled, so say it's because of hypertension. And then the V code for the canceled surgery would also be coded. In an observation stay, when a patient has an outpatient surgery and develops a complication requiring admission to an observation status, the first listed diagnosis would be the reason for the surgery, followed by the codes for the complication.